Hello, everyone. I'm Sherry with the CGH Health Foundation, and welcome to our Growing Healthier program for August. These programs are a way for us to introduce you to some of our newer providers and also to provide some education about our products and services at CGH. Dr. Bill Bird is the host of our program, and today he's going to be talking to nurse practitioner Ellie Bullis from our CGH Wound Healing Center. And they're going to be talking about specialized wound care for wounds that are difficult to heal. Maybe they're caused by injury, diabetes, or infection, but that should be a really good conversation today. And before we get to the program, I want to fill you in on just some new CGH Health Foundation news. Firstly, we have hired a new dementia coordinator. And so we're really excited to have Chris Trotter joining us effective Monday. She was formerly the director at Morningside Assisted Living. And so she's got a lot of great experience, and she'll be able to contribute to enhancing and continuing the programs that we've been providing for persons with dementia and their caregivers. So we're really looking forward to Chris coming on board. And I also want to remind you that our Delicious Designs annual virtual auction is coming up in October. So we're going to be looking for donations of baskets and experiences and baked goods and things like that. So just keep that in mind and be watching for more information about Delicious Designs. Let me tell you about next month's program before I turn it over to Dr. Bird. On Thursday, September 24th, we'll get a chance to meet Dr. Joseph Tan, new ophthalmologist with CGH, and we're going to be talking about advanced technologies for managing and treating conditions like glaucoma and cataracts and diabetic retinopathy. So watch for that program, and again, that's going to be on Thursday, September 24th at 12 noon here on Facebook Live. And with that being said, it's time for Dr. Bird to take over. Are you ready, Dr. Bird?
Always, Sherry. Thank you. Thank you for the intro. Appreciate it. Hello, everybody. This is Bill Bird, Chief Medical Officer at CGH Medical Center in Sterling, Illinois. Thank you for taking the time to watch our broadcast. And as Sherry said, today we're going to be talking with nurse practitioner Ellie Bullis to talk about our wound center. And Ellie joined our wound center recently and is doing a really nice job for patients there. So, Ellie, let's get you on. Hi there. Hi, Ellie.
Hello.
Welcome.
Thanks for having me.
And welcome to CGH.
Thank you.
Yeah, I was in your office, I think it was last week or whatever. How long you been with us now?
Since April.
Okay. All right. Yeah. So Ellie's been with us since April, and I was walking through and the staff were like, oh, she is so good with our patients.
No.
Yeah, so Ellie's doing a great job. She also has some great information to share with us today. So without further ado, Ellie, you ready for a few questions?
Yeah, let's roll.
Okay. How about tell us a little bit about yourself before we get into the wound questions?
Sure. I grew up in the Quad Cities, so I'm not actually originally from this area, but my husband and I moved here. We have a young son that we're raising in Morrison, and we just love it here. We love the small town community. Just love how quiet it is and how safe it feels to raise a child. I've been a nurse for 10 years, and then I was a nurse practitioner. I've been a nurse practitioner for the last 5 years.
Very nice. Good. Thank you very much. Okay, let's get into wound questions.
Sure.
So first question, what are some of the common problems that you run into when you're taking care of patients there at the wound center, Ellie?
Sure. A lot of the patients that are coming in to see us have these chronic wounds that they've had difficulty trying to heal at home for whatever reason. A lot of these people have wounds that may be exacerbated by other problems or conditions that they may have, like diabetes, vascular disorders, and other factors as well. We get a lot of referrals from other providers in our community, and they just maybe think that for whatever reason that patient just might need a little extra help kind of getting over that hump and starting their healing journey.
Do you see, besides like wounds in like a person's foot and leg, do you see any wounds that are maybe their buttocks area or right above that sacral area?
Yeah.
Do you see anything with bladders or uh, rectal things? And I was just kind of wondering about up here in a patient's jaw. Do you see any of that kind of stuff
Yeah.
pop up too?
Oh, yeah. We see a wide variety of different types of wounds. Pressure injuries are very big. So that's often, can people can break down on their buttock area. Just just a natural thing when they're, unfortunately can't move or get pressure off of that area.
Uh-huh.
Sometimes, there are other reasons too. Just maybe they had a surgery, and for whatever reason, maybe the wound just needs a little extra help healing.
Yeah. Okay.
Yeah, yeah,
How about like I know at least in the past we've had patients that have shown up that have had some radiation related issues in their bladder and their rectal area.
yes, yeah. So we can help with that. One of the things that we offer here is hyperbaric therapy, or hyperbaric oxygen therapy, I should say. And so we do see that a lot with
Okay.
radiation cystitis and hematuria and things.
Okay. How about like in people's jaws sometimes if they're on certain medications, like medicines to thicken your bones, they have a dental procedure, those kind of things that have some necrosis of their jaw. Is that something that the wound center also helps out with?
Yeah, yeah. So that's another indication for hyperbaric oxygen therapy.
Okay.
That can happen, you're right, from radiation, or sometimes people are on um, bisphosphonates, and when they have maybe a dental procedure or something where maybe it involves more of their gum tissue, they can develop the osteonecrosis and can be kind of a tricky thing to treat. So we work in coordination with uh, their dental team and try to provide hyperbaric oxygen therapy to help heal those wounds too.
Very good. Yeah, we've already kind of gotten into the treatments question, but I'm going to keep it going with that. We talked about hyperbaric oxygen. My understanding is that, there are certain situations like the necrosis and if you have radiation proctitis or something like that, where you have some blood, that you probably go right to that. But for a lot of the wounds, my understanding is there are other treatments before you get to the hyperbaric oxygen. You want to talk about some of those that you have available for patients who show up, Ellie?
Yeah. So when people show up, when we first do our consultation, we're just kind of looking at the whole patient and understanding maybe why their wounds are chronic. I think that's the biggest part of trying to start that healing journey with them, is just understanding who they are, what's their lifestyle like, and what have they done, what has worked for them, or what hasn't worked. And so we offer treatment. We typically see people once a week. Sometimes that can change though, and it can be more than that, or it could be less than that, depending on how things are looking. But we offer debridement in the clinic, which I think can be very vital to the healing of a wound, is trying to remove some of that devitalized tissue on top of the wound, or I guess tissue that is just kind of like acting like a wet blanket on the wound. It's not allowing it to heal. And so you kind of want to get that tissue off and allow it to heal. A lot of times that is requiring more of like a surgical debridement. So that's something that we do here in office. I think the other things that we offer that are maybe different than what you could do at home is we have a variety of dressings that we can choose from. There are different wounds need different things. So if perhaps a wound is draining more, you want to kind of stick to dressings that are going to try to absorb some of that moisture and try to keep that wound bed dry. Whereas on the flip side, if you have like a dry wound, you want to kind of add moisture to it so it helps to heal the wound. We also offer different things that can help offload the wound. So specifically for like diabetic patients, we want to make sure that they're in the proper shoe wear that can help get pressure off of that wound, because that is also going to help prevent
Sure.
any pressure will delay healing. And then compression is one of the biggest things that we use for people that have a history of venous reflux and have chronic wounds on their legs from that. Compression can be such a game changer for those people.
Okay.
And we offer that here. And it's just amazing. Like, you take a person with venous reflux and you finally confirm, okay, yes, they're safe to have the compression, and then they start the compression, and it's like 1 week and they're healed.
Okay.
So it's pretty amazing.
Yeah.
And then I think the last big thing that we've already kind of touched on is the hyperbaric oxygen therapy, which I think is unique to our area. We follow the Undersea and Hyperbaric Medicine Society, and we have very strict guidelines that we follow to make sure that these patients are getting safe care as well as effective care.
Yeah, very good. How about like bioskins and wound vacs?
Yeah. Very important. So we offer different types of skin subs as an option for
So
chronic
substitute skin, basically. Yeah.
Yeah.
Okay.
Yep. And they come in a variety of different cell types. Some of them are umbilical. And so I think that's always kind of a unique thing that we offer. Those are through different companies that we can order from if we feel like the wound might need a little extra help with a skin substitute. Negative pressure wound therapy with wound vacs is also incredibly helpful for some people. And we are able to kind of get that started, get that ordered. Those patients usually have home health as well to help them with the wound vac changes as well, which we work hand in hand with our home health nurses in our community, and they're all very fabulous. So,
is that trying to get more blood flow? Is that the wound vacs concept?
So
what's the backstory? What's the wound vac? A wound vac is basically sitting on that area and kind of vacuuming.
Yeah.
Yeah. I mean, you've put a vacuum on your face for fun and had a
yeah. And you're like, oh no.
That's essentially what we're doing here. So how
Yeah.
does that help? How does that help a wound heal, Ellie?
So it helps to stimulate new skin cell bud growth. So not necessarily the bleeding, although bleeding is actually kind of part of the healing cascade. It kind of kickstarts things. So, but the pressure or suction, that's not really the main goal to like get things bleeding.
Yeah.
But I think the common misconception with wound vacs is that you need drainage in order to have a wound vac. That's not the case at all. You don't need to have drainage, but you do need to have depth to a wound typically. Okay. There are advances currently that there are certain negative pressure wound treatments where they're the foam that they put in those wound vacs is changing, and it's called a peel in place, and you actually don't need depth for that. Okay. So we're kind of looking at utilizing that for maybe wounds that are draining a lot, that maybe could benefit more from constant suctioning, and seeing if that helps to heal those wounds a little quicker.
Yeah, sounds good. You touched on bleeding.
Yeah.
And for the people that I've taken care of that have wounds, one of the key concepts in terms of healing anything is you've got to have blood. You got to get blood to it, because that blood carries stuff that helps to heal that up. And so a big part of that is getting good blood flow. So you can do everything right and a wound won't heal if you don't have good blood flow.
Yeah.
And I say all that because we're going to have Dr. King, who's our vascular surgeon, on the call today. He's also the director of the wound center, because Dr. King helps with blood flow. Can you talk a little bit about, Ellie, about how Dr. King and his role as a vascular surgeon helps to heal patients at the wound center?
Yeah. So Dr. King has been a tremendous support to the wound center and to a lot of these patients. So oftentimes when they come in for the consultation, we're kind of looking at them, assessing their wounds. And usually when it's a lower extremity wound, I'm taking a listen to their pulses with a Doppler. And that kind of helps me understand, okay, just from listening, are these pulses strong? Are they weak? Is this person maybe someone that has an arterial issue versus a venous issue? And from there, if I deem kind of like, oh, maybe they do need a study to determine if the blood flow is limited, I will order that study. And then kind of based on those results, I decide, all right, they need to see Dr. King because they do have a blood flow issue. They're not getting blood down to their toes like they should. And then I just reach out to their team and get them connected. And I feel very fortunate that like everyone has been just so kind and welcoming, and like they're just a fabulous team over there. So we have great communication, but between the two departments to get these people connected and get them the care that they need.
Good. Very nice. Okay. I guess two other questions. First one is just like when you think about wounds, I think sometimes folks have a misconception about what it takes to prevent a wound and or the options in terms of can their wound get better or can it be treated? Can you speak to both of those for us, Ellie?
Yeah. So I think I think a lot of people follow some maybe more what we've been told our whole life is like, get the wound open to air and pour some peroxide on it.
Yeah, right.
I think we're all guilty of it. I mean, that's what I thought for a long time.
Yeah.
But unfortunately, those have been shown through research to actually negatively impact wound healing. So I think that can be, an issue. But I think a lot of people forget that like diet is a huge part of healing too. So making sure you're, eating appropriately, eating fruits, eating vegetables, all those vitamins and minerals are so important to healing and getting your body what it needs to be able to heal.
Yeah. Yeah. How about like more specifically, like folks who are diabetic who might have some difficulty feeling the bottoms of their feet?
Sure.
What, because I'm sure you see folks who maybe didn't have the footwear you would like them to have had, and then they show up to see you.
Yeah. That's common. I think that it's just one of those hard things that can be difficult for them. But I think one of the ways that they can kind of take control of the situation and gain like control or power of it again is just kind of doing daily checks. Honestly, if they're able to comfortably kind of manipulate their foot and be able to see the bottom of their foot, great. Otherwise, sometimes mirrors can be really helpful to have them kind of look at the bottom of their feet and see if there's any blisters or any new breakdown areas that might be a concern. And if they see those, we are more than welcome to have them come here and take a peek at it with them.
Yeah. You had, speaking of people coming and seeing you, so the typical cadence for patients coming to the wound center is how often, Ellie?
Typically, we see them on a weekly basis, but that can fluctuate a little too.
Yeah, and typically, I think I remember seeing that there is like a median time that it takes for most of the wounds to heal. Not that your results are going to be the same as I was going to say here, but just ballpark, what is our median healing time right now?
I think.
Do you know what percentage of our wounds are getting better? I threw you on the spot. I know.
Yeah, you did. I think, gosh, right now we've had a lot of healing. I would probably say I don't know, 4 or 5 weeks maybe.
Okay,
But there are conditions that do complicate that, and
sure.
sometimes they are longer,
Yeah, I get it.
but sometimes they are way short. Like I see them for a consult, and the next week they're healed.
Yeah,
Those are really cool. I like those.
yeah, for sure, for sure. Okay, Ellie, those are the main questions I wanted to ask you. Oh, and to make an appointment, I did forgot to ask that kind of key question. There you go.
Okay. Yep.
So
Call that number.
yeah, so I mean, you can get referred through your doctor to see the wound center and to see the doctors and Ellie that works there. But also, you can just call there,
Yep. Yep.
and
You don't need a referral.
they can get you in and take a look and see if they can help you out. And most likely, they will be able to. So, Ellie, thank you so much for your time. Good chatting with you.
Yeah.
And
Thank you.
for folks who are watching this, please feel free to share it with others if you found it helpful. Ellie, we'll see you around.
All right. Have a good day.
Thanks.
All right. Bye.
I wanted to highlight a few other things before I sign off. First of all, the gift shop has some new fall arrivals. I was just in there this morning. They have some, you can, what did they say? You can, with candles, you can make them personalized. They have beads or something like that. I was asking the staff there, so that's kind of cool. What else do we want to talk about? Yeah, Lindsay. So Lindsay's one of our pharmacists. She does a fabulous job and well-deserved Employee of the Month for Lindsay Olwine there in our CGH pharmacy here. And then, oh yeah, and next time that we get together, it's going to be with Dr. Tan, who is a recently arrived ophthalmologist here at CGH. And I think it's going to be interesting to talk with him because he has some different things that he can do to help patients out above and beyond what our current ophthalmology staff is able to do. So I think that's going to be good for folks to hear about. But we're very excited to have Dr. Tan with us, along with, of course, our other two ophthalmologists, Dr. Hahn and Dr. Pody. Okay, I think that will wrap it up for today. Thank you so much for taking the time to watch and share this with others if you find it helpful. Until next month, thank you for watching.